Let me ask you about sciatica. By the way, do more men get this than women, or is it equal?
No, a little bit more men, but you'll be surprised about the amount of ladies that are out there with sciatica.
Describe where the pain is. Describe what it is.
So sciatica, a lot of people say, I have sciatica, and they point to the back, which is half true, but to be actual sciatica, it has to be a problem with the sciatic nerve, meaning it's shooting down pain or weakness.
Shooting down the leg?
Down the leg.
And the top of the buttocks?
Correct.
Okay.
And we can help those patients. So the most common treatment we do is an epidural steroid injection, but instead of just putting it down in the middle, we actually can target it to it's called a transforaminal epidural, which using X-ray, we target exactly where the problem is so we can flood that area. Before we used to do an interlaminar epidural where the medication just goes everywhere, a little bit to where you need it. Now we're able to target with newer techniques exactly where you need it, and all the medication stays there.
So are you looking at a monitor while you're injecting this area?
Yeah, exactly.
Okay.
So we guide the needle with the monitor, and then to ensure safety, we also inject contrast where we can see on the X-ray where it goes. It should stay. So we don't want it to be in a blood vessel, for example. And it's for safety, and it's for targeting the treatment better.
And it works well.
Works very well.
Sciatica is an easy one to treat if you catch it early?
Yes, definitely. It's one of the most common treatments we do.
What's another treatment for sciatica that you do?
We can do PRP, so we use something called platelet lysate. So we break down the platelets, and it's a very potent anti-inflammatory to the nerve. So some patients, they don't want steroids, or it's just not helping them long enough. We offer platelet lysate, which is like PRP, but for the epidural space. We basically cause less inflammation when we break down the platelets for the patients. It's a very specific treatment that we can do.
And the sciatica, how fast does it go away? Like when it works? Like, is it immediate? Does it take a week?
Probably 30% is immediate, and the other 70% takes 3 to 5 days for them to feel a little better, and up to 10 days to have a significant change. But I mean, 10 days is not a long wait when they're in pain.
Is this one of those things that if you take care of it early, does it not come back? Or is it always going to come and go throughout their lives?
It's very likely a lifestyle type of thing. So we have to coach them on how to prevent it from coming back.